So, synoptic operative reports in gynecologic cancers have now been used in Calgary for the last 3.5 to 4 years. In the last 6 months, Edmonton is also now using these templates, and the focus essentially has been in using these templates for surgery related to ovarian cancer and various cancers of the uterus. The reason why it has worked very well is that it does collect a lot more information than one would get with a didactic operative report. Now, this was well documented a number of years ago in Ontario, where it was felt that only 24% of these reports were in fact adequate. It's important certainly for ovarian cancer and endometrial cancer to have synoptic reports because they're far more detailed. They give us information as to exactly where the disease is, and most importantly, particularly with advanced ovarian cancers, it gives us details on how much disease is left behind following surgery. This does improve decision making in the future when these patients may get a recurrence of their cancer of their ovary. The benefits also of synoptic reports is that this can be done quite quickly after surgery. The reports are available within 10 minutes after we've done these reports, so that the report is on the chart when the patient goes back to the ward. Therefore, it doesn't take 3 to 4 weeks as it has done in the past. Family physicians and other physicians involved in care will get these reports also within 24 hours, and that's again important as far as management of these cases go. It certainly is also, because it's so quick and fast, there's no transcription required. There is a significant cost saving as well. The other aspect with these reports is that we can look at outcomes in terms of surgery. For instance, we may want to have information on how many bowel resections have been done, with as to giving us an idea of how we're doing as far as these surgical procedures go and how we can improve things.
This demo will take you through the process of entering an operative report for breast cancer surgery using the Alberta WebSMR. Log into the system and select the appropriate tumor site from the drop-down menu. Once you select a tumor group, you may click on the Outcomes button to view your individual outcomes alongside the provincial aggregate. Select the patient from your patient list. Select the appropriate template for your surgical procedure. Decision-making questions have been implemented into the breast template for educational and resource allocation purposes. The survey is composed of drop-down menus, checkboxes, radio buttons, and a limited amount of typing. Hyperlinks have been inserted into the template as access points to various references. This NCCN link will open up the relevant NCCN breast cancer guidelines in a new window. Questions with the red asterisks are mandatory fields. These questions must be answered in order to proceed forward with the operative report. Branching technology has been implemented throughout the WebSMR where appropriate, so that users may take the shortest possible path. For example, if a surgeon conducted breast-conserving surgery, it is not necessary to read and answer mastectomy questions. Comment boxes are present for cases where the template cannot cover every aspect of a surgery. Once the survey has been completed, you may preview the report. Click Submit to submit the report, creating a legal document. Note the distribution list in the report header. Additional recipients can be added using the Modify Carbon Copies button. Once the report has been submitted, an electronic signature is added and the report is complete.